Dr. Fake, the patient from 301 is having a fever of 105 and he's bleeding through his nose.
Oh, don't worry. I have already checked him with my pulse or my magic clip, and we are still not at 80, so we don't need to do anything. In fact, I just finished my course at WhatsApp University, and it never goes wrong, so he's just fine. Don't worry about it.
Okay, doctor. Doctor!
What now?
The patient just died.
Oh. I should have given him vitamin C instead. Oh well. Friends and followers, good morning to you. The coronavirus is really kicking our butts, right? Even after 9 months, or has it been 10? Anyway, even after 9 months, we are under some sort of lockdown, and ever since the lockdown began, I began to wonder whether there being no public transport and the fact that sometimes the hospitals would be understaffed, whether available to emergency medical services would be hampered in any way. And kudos to them, it really hasn't, but it still prompted me to improve my personal level of preparedness. So I have upgraded my first aid box from a simple bandages and an antiseptic to a more advanced version, and I will go over these what I have assembled in this kit in a short while, but in doing so, I would only remind you that it's something to do with preparedness. If you have ever been a Boy Scout or know somebody who has, they will say that their motto is be prepared, and that's exactly what this is. You know, you be prepared for any kind of first aid and emergency cases that might be in your home, and hoping that you never have to use it ever in your life. That's what it means basically. Now, the cornerstone of any emergency preparedness is discipline. I could have taken the example of the military in order to explain to you that discipline, but then again, most of us are not part of the military. So the best example for a civilian would be the airline industry. I challenge you that never in your life have you taken a commercial flight where the pilot or the air hostess hasn't given you a safety briefing. And they are fully aware that something going wrong during the flight is very slim, and yet they do that without failure. That's the type of discipline that you require for medical emergencies at home as well. First of all, you need a first aid box. You don't want these to be somewhere in your house. In an emergency, you won't go out rummaging for them. And again, the greatest analogy is the location of the life jacket in an aircraft. It's in a pouch under your seat. The air hostess doesn't tell you it's somewhere. You go out searching for it in an emergency. So that's why you should first have a first aid box like so, which you keep in a prominent location in your house and what you can access readily in an emergency. Okay. So let's go over the contents of my first aid kit. I'm going to start with the standard disinfectants. So I generally keep 2 bottles of betadine solution and 2 bottles of Savlon. Now you will notice that these bottles were not sealed at the factory. The reason being, ever since the pandemic struck, it was really difficult to get disinfectants in small bottles. They always came in big 1-liter bottles, and I really could not fit them in my first aid box. So I took standard amber colored bottle, disinfected them, filled them with the desired disinfectant, labeled them along with the date, and then wrapped them in saran wrap. I certainly don't recommend you do this. If possible, get small bottles sealed at the factory. But if you don't, I guess this is an acceptable solution. Apart from betadine and Savlon as my disinfectant, I also keep disinfectants in the form of a gel. So again, these are betadine gels. They are useful in being applied as a thicker coat on a wound and then being dressed over. And again, all these are over-the-counter medicine. You don't require a prescription to buy them and keep them at your house, but do keep them away from children. I also keep 2 tubes of Silverex. So again, these are disinfectants with silver in them. I tend to apply these more on minor burns. Now, unlike the rest, it says here that it's not a schedule H drug, but it says here you require a prescription. So do ask your local pharmacy if you're allowed to keep these without a prescription. It's Silver X Ionic. So those are my disinfectants. You cannot go wrong with a packet of Band-Aid. You should definitely keep a packet of Band-Aid in your first aid box. Surgical cotton, make sure it's surgical cotton and not the one which you get in your local grocery store. They are not sterilized. You should not be using them on an open wound. So surgical cotton. This is a cool material. It's the medical equivalent of Scotch tape. It's made by 3M and it's called micropore. You'd use this exactly like you'd use sellotape or Scotch tape. You put a bandage and then you can secure the ends by using this, and also it's safe to be used directly on the skin. Scissors and a pair of tweezers, again pretty obvious, scissors to cut your bandage or gauze, and a pair of tweezers to take out splinters. I do keep a thermometer in my first aid box to keep, I know where to access it. I have other thermometers around the house, one in my kitchen drawer, but I choose to have one in my first aid box as well. A few days back, I did go out and buy a pulse oximeter, and I will go over how to use these in a short while after I finish the remaining contents of my first aid kit, so stick around to find more about that. I really like this design of the first aid box with the removable tray. It helps me arrange the medicines a lot better. So here I start with my standard sterile gauze. I keep several packets of them. Make sure it's the sterilized kind because you don't want to put any unsterilized gauze on an open wound, especially in an emergency. So make sure you have these. I keep 2 packets of earbuds. For obvious reason, I keep 2 packets again because I may use one and forget to replace it. So I keep 2. We are in coronavirus times, right? So a bottle of hand sanitizer is absolutely essential. Before you render first aid, you make sure you sanitize your hands. I actually should keep 2 bottles of these. I'll do that in the coming days. Along the same lines, you should always have 2 packets, 2 or perhaps more of these sterile gloves. If you think you might come into contact with a lot of blood or some other fluids from another person, you should put them on. Again, I think more than 2 would be even better. On similar lines, you should have a mask in your first aid box. You should wear them before you render first aid, especially if you're concerned about coming in close proximity with somebody who might be infected. Make sure it's a 3-layered mask. You can definitely buy them at the store, or you can make them at your home inexpensively. I have a video out which shows you how you can make these. The link is in the description. About 2 meters of crepe bandages. You can use them to secure a sprain either on the wrist or on the ankle, till at least you can get him or her to a doctor. You should definitely have these. This is a blue gel pack. It's a nice product. It's a blue gel pack which you can instantly heat up in a microwave to be used as a hot pack. In an emergency, they can be only used as a hot pack. However, they are also good as cold packs. So once you put them in the refrigerator, but that takes about an hour to cool down. So you cannot use these as cold packs in an emergency, but they are super efficient in being used as hot packs. These are 2 bottles of Move spray, similar to Iodex. You can apply them to sprains, but let me remind you, they are only for symptomatic reliefs. They really don't cure anything, so make sure you get them checked out with a doctor. The last topic is a little difficult to cover because ideally first aid box should not contain any medicine whatsoever. This being coronavirus times, I have decided to keep a file of standard paracetamol in my first aid kit. This is definitely not a schedule-age drug, so you can buy them over the counter. But me not being a doctor, I don't I definitely don't recommend you using these or keeping these with you. It's your entire personal choice as to whether you want to have them, but I certainly do choose to have them in my first aid box. I also have 2 packets of ORS. So these are basically rehydration salts. They're a mixture of sugar and salt. I believe you mix them with water and feed them to a person suffering from dehydration, and especially if they're having a lot of diarrhea or a bout of vomiting, these are very useful. Now, speaking of medicine, I also recommend you to keep certain medications which your family might require in an emergency along with your first aid box. Some examples would be probably your standard inhaler if somebody in your house is suffering from asthma. In case somebody has a severe peanut allergy or latex allergy, for example, would be a shot of what's it called, epinephrine, I believe. For example, when my father and I used to share the same apartment, I always kept files of aspirin and nitroglycerin in my first aid box because he has a heart issue, let's say. But before you go out and do that and you buy any medicine whatsoever, consult your GP or your doctor. I'm sure she or he would be able to guide you on that. Don't go out buying your own medicine. Okay, so that basically concludes the content of my first aid box. We're going to cut over to another part of the video where I talk about how you use the pulse oximeter, and also we'll cover some other medical devices which you can keep around the house. Okay, now the part that most of you are probably waiting for is what about these devices, the fingertip pulse oximeters? Well, let me tell you, they are legit medical devices, okay? What they measure is basically the amount of oxygen saturation in your blood. The reason why these devices are being talked about these days is because in standard COVID infection, one of the symptoms, particularly severe symptoms, is an impaired lung function. And as you know, one of the purposes of the lung is to oxygenate your blood. And these devices sort of indirectly measure the amount of oxygen that's there in your blood. I say indirectly because they don't actually measure the amount of oxygen. What they do is they measure basically the color profile of the blood in your fingertip. Blood that has oxygen in it has a slightly different color profile, and the way it does that is pretty cool. So I don't know if you can see this. There's actually a red light inside, and there's a sensor on the other side of it, and basically it's measuring the amount of that wavelength of light passing through. Now that's basically what the device says. To use them is quite simple. You just turn it on and then put it on your finger like so, and wait till a reading shows up. So right now it's measuring, for example. Yeah, so for example, right now it says I have a saturation of 99%, I have a pulse rate of 79, and a perfusion index of 3.2. These three units I will explain slightly. So the percentage saturation, of course, the amount, the relative amount of oxygen that's there in my blood relative to what it can contain. So it contains, the maximum it can have is about 100%. So I'm at 99%, which is good enough. I think any value above 95 is just fine. It gives me the pulse rate, which is as simple as capturing your pulse rate, and it also gives me another reading called the perfusion index. I don't think the common person would really understand what that is. In layman's term, it's just a measure of how well your fingertip is being supplied with blood. I'm not exactly sure for what reason medical professionals would use that term for. So coming back to the first reading, that's the oxygen saturation. It's, again, as I said, it's a measure of how well your lungs, of somebody's lungs are functioning. and if there's some kind of impairment, you'd expect to see that number falling. And here's my problem with these devices. Look, it just gives you a reading, and that's easy to get. The difficult part is actually interpreting that reading. Now, there are several WhatsApp messages going on which say that any reading above 80 means you have to go to the hospital, or till 90 you're fine, don't have to do anything, and I'm totally against that. Look, you're not a doctor. It's best that if you do have these devices, you take a reading, and then when you talk to the doctor, you can tell him that I have checked his oxygen saturation, it's at 80% or at 90% or whatever, and let the doctor decide on the course of action. I certainly don't suggest you be your own doctor in interpreting the results of these devices. Okay, and I mean, there are cases where you might get an incorrect reading as well. If somebody has a very thick nail polish on, especially if it's of the color red, then it might interfere. And I'm not exactly sure, but they are not very reliable on newborns. So you have to keep that in mind. Other than that, as I said, they are legit medical devices. They cost as low as 700 rupees on Amazon, and it's not really legal for you to own. So if you want another toy at your home and it makes you feel a little more prepared, then by all means get them. But I cannot stress this enough, don't be your own doctor when you try to use them. I think the current advice that whenever a person is actually suffering from breathlessness or having difficulty breathing, you talk to a doctor or take him to the hospital. I think that's a more reliable thing to, a more reliable indicator of the severity of a suspected COVID infection. That being said, you can certainly keep them in your first aid box. Only thing to remember, don't keep them with their batteries inside. They sometimes leak, and in an emergency you might not be able to use it. Once they leak, they don't work. So what I suggested, you keep a pair of sealed batteries in your first aid box along with this minus the batteries. And in case you're unfortunate enough to have to take care of somebody suffering from a suspected COVID infection, you can certainly go ahead and check their oxygen saturation, and especially if they are suffering from shortness of breath or having difficulty breathing, you have to consult a doctor. And then if you have this reading, I think it will help the doctor make a more informed decision. So yeah, that's how the pulse oximeter works. On the same breath, I would also urge you to get two other medical devices for home use. One of them would be a blood pressure monitor and a glucose meter. Now, I especially expect you to keep these in case you have senior citizens in your home, or you know people in your family are suffering from specific ailments, be it diabetes or hypertension. Now, obviously, again, please ask your doctor once whether you can use these devices, especially if you want to use them as replacement for in-clinic tests on a regular basis. I certainly cannot vouch for their accuracy. I mean, I have seen the entire spectrum of argument in terms of their accuracy. I have some doctors said they are quite accurate, and in fact I have seen these particular ones being used in the doctor's office. And at the same time, I have heard several doctors saying they are not very accurate and should not be relied upon. So again, it's a decision left to your doctor, I think. But in this COVID crisis and in the lockdown, I suggest these at home because A, it gives you a quick reading in an emergency, and B, if you regularly have to go out to your local drugstore or the clinic to get yourself tested every week, these can help you cut down on those visits and potentially save you from some kind of exposure you might be having in a in a public place like a hospital. So yeah, I strongly suggest you keep these two instruments at home. Okay, so that basically concludes the material part of my personal COVID or the pandemic preparedness, especially when it comes to medical emergencies. However, other than these, there's a much more fundamental and important arsenal you can have at your home. Get yourself trained in first aid. If you work in a place with an employer who has a first aid program, you can certainly volunteer for them. I know local Red Cross chapters will often have a number of first aid trainings a year. Most of the time they are actually free, so you can definitely enroll for them as well. And if none of that works, especially in the lockdown, you can obviously look at some YouTube resources. I will try to put some links below. You can certainly check them out as well. And any good first aid training will teach you that being a first aider, being a certified first aider doesn't make you a doctor. However, it does equip you in making sure that a person receives due medical care before she or he can be taken to a doctor. Now, that's the end of this video, but I will leave with a question, especially if there's a doctor who's viewing this video. This is a specific question for you. So when I was taught first aid, I was definitely made to understand that the threshold for something being a simple first aid case or a first aid case with escalation, where first aid and then taking her or him to a doctor, and we were kind of taught to gauge that threshold, whether or not to take him to a doctor. And I understand that threshold for first aid cases is very, very low indeed. So here's my question. Now that we are in a lockdown and the health infrastructure is already strained, and any visit to a hospital, especially if it's not warranted, will lead to further exposure of an otherwise healthy individual. So do you think that that threshold needs to be revised for all first aiders? I mean, it's an open question. I'd love to hear about it. And I'll say goodbye to you today, and I'll see you next time. Goodbye.